So today I'm here with my good friend, Miss Rene Daman. Did I say your last name right?
You did.
Okay.
Yep.
I always am worried about that, but she is the director of the Oklahoma Autism Network, correct?
Mm-hmm.
I usually start these by telling how we met, but I'm not really sure exactly when we met. I know it was right around 2013 because I was in Partners in Policy Making about that time, and I want to say you came and did the presentation for us. Maybe, but
I may have, or I know our paths have crossed so many times just in the world. I think I'm like you. I can't remember at which specific event or time. It's just, I don't know. I feel like I've just known you for a long time, but I don't remember when it started.
Well, and I meet a lot of people, everybody that I've done so far. It's other than Diana. I remember how I met Diana and Wanda because they were during the Partners in Policymaking. But most of it is I used to go to conferences, which I still do, but I used to go to conferences all the time when I first got started advocating for my son. And I was just trying to pick up anything. And so it could have been you were at a booth and I was just absorbing all the information I could. So, but
Yeah,
anyways,
sure.
Long story short, we've known each other for quite a while. You are kind of, you're one of my two gurus when it comes to autism specifically.
Well,
My
thank
other
you.
one is, and I hope to have her on here soon, is Angela Donnelly. So I go,
Yes.
you two are my go-tos, and it's usually in that order, you and then her. So, but tell me.
I appreciate that.
Yeah, well, you're a wealth of knowledge, that's for sure. Tell me your story. Tell me how you got started as an advocate.
Well, I guess, do you want me to go to the beginning? um, I'll try to condense it. I'll try to make it as short as possible. But I guess we communicated by email, and I was like, okay, what should I expect? It made me kind of start reflecting and thinking back. But I really have to say it kind of all started freshman year at OU back in '87. Dating myself a little bit. I was trying to figure out what I wanted to do and was always interested in health and wellness and enjoyed working with children. I knew that. And my dad is the one that planted the seed and said, hey, you ought to look into physical therapy. Because my brother had had multiple knee surgeries and had needed a lot of physical therapy. So I was like, I'm going to check that out. So I did. And freshman year at OU, I decided that's what I wanted to do. And so I thought, well, if I want to be a PT and work with children, as I started investigating, I started figuring out that probably meant I was going to work with children with disabilities. And I had not really had experience with kids with disabilities at that point. And I thought, well, I better figure out if this is something, that I'm comfortable with. I didn't grow up in the era where kids were included as much. I remember kids with disabilities being in the schools, but they weren't included as much. So I actually, my freshman year at OU, started volunteering in the evenings at J.D. McCarty Center and working with some of the recreational therapists and, taking the kids swimming and that kind of thing. And I loved it. So then I went to PT school, they train you as a generalist. So I had to keep an open mind about, okay, I have to learn to work with adults and, that kind of thing. But I went through knowing, okay, I probably want to work in pediatrics. So I was lucky enough to have two of my clinicals in pediatric settings, one in a large outpatient clinic in Tulsa, and then the other one at Children's Hospital. And so I started working in developmental disabilities right out of school in '93, and was lucky, those kind of hindsight things, like my first job in that large outpatient clinic, I had the opportunity to work with little bitties because we worked with a lot of kids through Sooner Start. But then I also supported individuals in a couple of ICFMRs. And individuals who had just been transitioned out of HISM because HISM was closing at the time. So I kind of got that lifespan perspective from that first job, which I probably didn't realize the value of in that moment, but in hindsight, I did. And I also started working with children with autism at that time, because the clinic director, it was at Therapy Works in Tulsa, she wanted an OT and a PT. Sensory integration theory and treatment was big at the time. And so my first continuing ed class out of PT school was sensory integration theory and treatment. And so I was the PT on the treatment team that served kids with autism. And then I went to work at Jenks Public Schools a couple of years after that. And that's when I also had started my master's program at that time, because when I graduated from PT school, it was a bachelor's program. And so I had mentors at the time who really influenced and shaped my thinking and advocating, self-determination, family-centered care, inclusion, just best practice. Irene McEwen and Melissa Sheldon and Lori Sylvester, people who were really leaders in our state at that time. And then I got to work at Jenks, where there were a couple of state improvement grants at the time, I think, looking at really promoting inclusion of students with disabilities, and Jenks was one of the schools that was really implementing that. So as a related service provider, I really out of the gate, between my master's and working at Jenks, got to see best practice. And I think that's one of the things that really taught me. I mean, Melissa and Irene and all of those individuals really helped me in learning how to advocate for families. But inclusion, seeing inclusion done right, is like one of the most amazing things you can ever witness. It was really fun, because I got to spend a lot of time in gen ed classes and work alongside the teachers, and it was a lot of fun. So those were some of the early things I think that shaped my thinking. And then I think one of the other things that happened is we have some close friends who are still close friends of ours. When we lived in Tulsa, they have a daughter with autism who has high level needs, and we spent a lot of time with them as a family. And that was really my first experience seeing up close and personal the family side of having a child with a lot of needs, and kind of walked alongside them through some pretty kind of challenging times. And I think that really opened my eyes to the family side of it. So I think some of those early experiences are what really shaped me. And then I got to work a lot with Jim Nicholson when we started the Oklahoma Autism Network, and I learned a ton from him. So
yeah, Jim Nicholson, there's a lot of stuff you just talked about in there. Jim Nicholson was great. For those that don't know, he was the head of DDS.
For a lot of, like, the longest person to be in that position, the longest, through the closing of HISM and lots of things. But it was like a real privilege to get to work with him so closely for so long.
You also talked about Jenks, and I've always noticed, or at least it seems like from the outside looking in, they have such a good their inclusion has always been kind of ahead of everybody else. And I think that's a really good thing. In fact, I use their model for some of our peer mentoring programs that we do here, and loosely, very loosely, because they're really good at what they do. But I took that idea and I kind of ran with that. But anyways, talk about Oklahoma Autism Network. Tell me, for somebody that doesn't know, let's say newly diagnosed, I always talk about newly diagnosed parents. Tell me what the Oklahoma Autism Network is.
Well, we are housed at the OU Health Sciences Center. We're part of the Lee Michener Tolbert Center for Developmental Disabilities and Autism in the College of Allied Health. And we started in 2003. Back at that time, there had been a group of advocates and stakeholders who had gotten together for a couple of years, really looking. That's when people were starting to talk more about autism. The prevalence was starting to increase, but it was nowhere near what it is now. And a group of stakeholders, a working group, got together and for several years worked on what's the Individuals with Autism and Their Families Oklahoma Plan, which you can see on our website. And in that plan, they had multiple things they outlined looking at, based on kind of how things were at that time, what they thought was a plan for how to build the capacity of our state to meet what were the growing numbers of individuals with autism. And one of the steps in that plan was developing what they called an administrative unit. And it was not with the intent of like overseeing everything in our state that happens around autism, but being kind of like a coordinating, collaborative piece to bring different components together. And so when they wrote that plan, they had identified 2 possible options for how to start that. And Dr. Irene McEwen, who was the director of the Tolbert Center at that time, and Marty Ferretti, who was the chair of our program, the Department of Rehab Science, had a really strong relationship with a lot of the leaders in some of the agencies. And so DHS was outlined as one of the funders to help start that. And Jim Nicholson came to Dr. McEwen and said, we would like you guys to start this. So I started it in 2003 because Irene said, hey, Rene, would you like to do this? And I said, oh, sure, having really no clue what I was getting into. But so we started it it started 2 days a week of my job with the idea at that point in time, because it was also a down fiscal year, as we're kind of experiencing right now due to coronavirus, as just a virtual network. And really our role, what we, kind of what it's morphed into and what we do is we're the state resource and referral. So we help connect families and professionals with resources in their community. We help families with everything from, oh, I think I'm moving to Oklahoma, what are the resources available, to my child just got diagnosed, and I'm not sure where to start. I got this report with all these recommendations, all the way to calls from parents of adults or adults themselves, looking for resources and things. So we're the state resource and referral. We do a lot of different things, like a lot of training for families and for professionals. We coordinate the Oklahoma Statewide Autism Conference, have worked a lot over the years with the agencies and the legislature on things like the Senate Bill 135 back in 2008 and autism insurance, just kind of all of those things. So, and then we also we've worked a lot with community groups over the years, because part of our mission is really looking at how to support the capacity of the community so families can get out and do things that every other family does. So a variety of things.
Yeah, so you guys, I'll be honest, I mean, you probably know this, but we took a lot of that, and when we decided to do the Pervasive Parenting Center, that's kind of what we concentrate in 4 counties over here. You guys do the entire state, and we utilize you guys a lot, and I know you guys, referrals to us a lot, and I appreciate that. I mean,
absolutely.
We work well together, because I mean, I always tell people I don't know everything, but I know people that know things, and so you're one of my people that know things. So.
Well, and you're one of our people who knows things, because it's impossible for us to know all of the details. You know your area better than anybody. You know your families, you know the needs, and I think that's why it is this partnership. I mean, collaboration between all our groups, because you support your community in a way that there's no way we can do that in the same way that you do. It's a huge benefit to your families to have you all, and the professionals too, to have you all as a resource right there, and building the capacity of your area in a way that somebody from Oklahoma City can't do,
Yeah, well, and on that, I mean, we've called you guys to come in and do trainings too, for us or alongside us, and it's been a great collaboration. You hit a little bit on mentors earlier. Tell me, who were some of your influences? Who are some of your biggest mentors, and maybe how they influenced you?
Well, I mean, I think for sure, very early on, I was really, really fortunate to have, like Dr. Melissa Sheldon was she was the faculty of our neurodevelopmental class when I was in PT school. And she was the chair of my thesis committee when I went through my master's program. And so she and Dr. Lori Sylvester, I don't know if you know Lori, but Lori still works with like DHS and supports individuals out in the community on the waiver programs and things. So they were some of my earliest influences, and really the thing I think I took away the most from them is we have to think bigger picture. You have to think abilities, not just deficits and disability. You got to think about family, because children live in the context of a family. So we have to think about, as professionals, how are we truly partnering with families, not just telling families what we think they should do. So I think they were huge influences for me early on. And Irene McEwen, Dr. McEwen, she's retired and has been for quite a while now, but I mean, she was nationally recognized as a leader in the field of physical therapy and special education, and people first, and just thinking, bigger picture about our role. And, even little things, like I say little things, but they're not, like as therapists, we're trained to conduct evaluations, do an assessment of a child, identify deficits, and then write our goals based on those deficits. And, they taught me early on, it's bigger than that. You can't just focus on, oh, a child missed these items on a standardized test, I'm going to turn that into a goal. It's got to be bigger than that. So, and then Melissa went on to North Carolina, and actually has done training in early intervention programs around the country and coaching practices. And so she continued to influence me in the sense that she came back and trained our team to fidelity in the use of coaching for the research project we did for the legislature. So, I mean, she was a huge influence. Both of them were huge influences on me. Dee Blose actually was a family faculty in my master's class, several of my master's courses. And so she influenced my thinking about families. So Dee worked with us a lot early on with the network when we started doing a lot of parent training, because when I started, when we were asked to start the network, it was kind of like, okay, blank slate, and my thing was, families don't have enough support, and families are more important in the child's life over the course of their lifetime than anybody else. So how do we better support families? So Dee was a big part of that. I think since that time, people like all my coworkers, I've had an awesome, team that I've always been able to work with Julie Smith and Ginger Wells, and just lots of people that I've worked with through the center. I talked about Jim already. And then later on, when I decided to become a behavior analyst, when we were implementing the research project, Dr. Shala Ale Rosales out of the University of North Texas, who is internationally recognized, as she's just like one of the most amazing people I've ever met in my life. I just love her. She collaborated with us on the ConnectedKids research project. And so she would come up from UNT and we would have work days. She just, she really shaped my thinking a lot. And then Nicole Carr, she's a faculty at OU now. She wasn't then, but she was my fieldwork supervisor. So, I just had an opportunity to meet and work with lots of awesome people over the years who've kind of shaped my thinking.
Yeah, it's crazy the network that you gain just when you start in. I started as a parent. I still am a parent. That's my main focus. But I was talking to somebody the other day. We go to the Oklahoma Autism Network puts on the state autism conference every year, and I love going to that. But when it started, I was that parent that wanted to just take in everything. I needed to know everything. You get into that research mode, and you need to know.
Right.
And then now, I get more out of networking, I think,
Mm-hmm.
the people last year, or this last conference that we went to, I did a little interview with you, but we sat there with Angela Donnelly and Jen Randall, and just going around the tables that are there, and just talking to people. You gain
Mm-hmm.
so much knowledge from that. um, and no offense to anybody that does the workshops, because I think they're great, but I get more out of that than I do sitting in the workshops sometimes, because and not always,
Yeah.
but most of the time, just because you've got those connections, and you've got people that have been through those things. Anyways, I think those conferences are really important for both reasons.
Yeah.
But You talked about D, and I'm trying to get D on.
Mm-hmm.
There's some things going
Yeah.
on right now with her, but as soon as things start to clear, I'm going to try to get her on. I think she is a wealth of knowledge, um, and her son David is awesome. We have
Yes.
we have his artwork all over. In fact, I should my mouse pad is David.
Oh, that's great.
So I love his stuff. But anyways, we're going to try to get her on when we can. What can you tell parents about ABA? As somebody that doesn't know anything about ABA, what is that?
Well, I mean, applied behavior analysis is the science of looking at environmental variables and how they influence behavior. So, as a behavior analyst, you're looking at, what happens right before a behavior, what that behavior is specifically, and then what are the consequences or things that follow that behavior, that either make it more likely that that child's going to engage in that behavior in the future, or less likely, or for any of us. ABA applies to any of us. ABA is one of the most evidence-based interventions for children with autism. I know it's one of the interventions that many families seek, because it's one that's often recommended when their child's evaluated or diagnosed. And I think how ABA is implemented can look lots of different ways. I think the most common model that's used currently is an intensive behavioral intervention model. And often that's used or available to families in clinical settings, or sometimes in their home and other settings as well. I don't know if that summarizes what you're looking
No,
for.
that's good. I was just thinking it's tough for us because we don't. I think the closest ABA, at least in the state for us, is probably. Is there somebody in Muskogee? I know Tulsa.
Yeah, Tulsa for sure. There might be somebody in Muskogee. I'd have to look.
I can't remember. Now we have somebody, but this is pretty new, and I don't know anything about them, across in Fort Smith, Arkansas. That's only 30 minutes away for us. So, but I don't know much about them, and we struggle with Sooner Care. So,
Payment sources.
but I like the fact that letting parents at least know what it is, and hopefully start getting. I hoped that with the autism reform, we would start seeing more ABA maybe growing throughout some of the rural areas, or some of the even the kind of bigger small
Yeah,
cities.
bigger, small areas.
Yeah, you know what I
I
mean.
would hope so. I mean, I think the clinics are still so heavily concentrated in the Tulsa and Oklahoma City metro area.
Yeah. But at least that gives them something to know what that is. Now we do have some. Instead of ABA, we have some play therapy, and we have some behavior therapists, but they're not ABA, so to speak. So that's as close as I can get. So I do send some to those. But anyways, tell me advice. It's kind of tell me the best advice you've ever received. Tell me the advice that you give to parents, and then well, let's start with that.
Okay. Well, and I have to say, as you think about that too, that the one thing I would be remiss if I did not say is the other people that have mentored me over the years and in many ways been the best teachers is the parents and the families and the individuals themselves. I mean, that's one of the things I love about our conference is when I get to know, and just through the work, you know, getting to know individuals themselves. I think that those are the best teachers too. The best advice I've been given, I don't know if I could like narrow it down to one thing, except I think probably one of the things probably one of the things that's been the best advice as far as working with families is to be aware of your own biases. I mean, in the sense that when you go in, like my favorite thing to do is to work with families in their homes, just because I feel like that is where I'm probably more effective than anywhere else, because that's where kids live, that's where they spend their time. And if you're going to support a family and really support them effectively, I think you have to just see like, okay, yeah, I've had families tell me over the years, oh, I went and bought all the toys they had at the therapy clinic because I thought that was like the magic part of whatever was happening. And when you see what the family has and you support them and using what, you know, supporting them in their own environment. But I think when you go work with families, you have to be aware of your own biases, because you have to be always mindful of not letting your biases influence your ability to support that family. Because anytime you support families, we've worked with families where we had to spend, and I wasn't the primary service provider in this, I was supporting one of our therapists who was supporting this family. But over the years, I've worked with families who live in all different kinds of conditions, whose family life looks very different than my family life, and whose values are maybe different than my values. But I can't let my values and my biases and my beliefs interfere with my ability to support that family. And if I'm biased and I'm judging them because they aren't doing this or that the way I think they should, then, you know, people pick up on that and it gets in the way. So that's probably one of the best pieces of advice I've been given. And I think something that, like, as human beings, we always have to check ourselves on, right? Because I have lots of opinions. So that's probably one of the best pieces of advice. And then as far as what I tell families, I guess, I think just, sometimes I think when a child is diagnosed with any type of disability or medical need, that we don't always intentionally, but sometimes, because, you know, parents come to us because we have, as professionals, because we have expertise in whatever their child's need might be, whether it's autism or they have a feeding issue or they have, you know, cerebral palsy. And I think sometimes because we have expertise in whatever that specific need is if we're not careful, we can cause families to feel like they don't have the knowledge they need to really adequately support their child, if that makes sense. And so I think what I always just tell families is really you are more important in your child's life than anybody else. You're the only one there over the course of a lifetime. We as professionals come and go. Teachers come and go. And even Jim Nicholson would say, who's there at the end? After the kids get out of school, after most of them are not receiving as much therapy, the parent and sometimes DDS if the child's on the waiver. You know what I mean? So I would just always try to help families under you are more important than anyone else in your child's life. That it is our role as professionals to support you in supporting your child, not to ever make a parent feel like they don't know enough or we know more than they do. And to really just have the expectation from professionals that we are going to support you in supporting your child. I think families, you know, I think should always be welcome and should be part of whatever intervention their child is receiving, because I mean, I've always told parents, I'm not going to fix anything in 60 minutes a week. And for ABA, I'm also not going to fix anything in 20 hours a week or 30 hours a week. If the family doesn't feel confident in their ability to use some of these tools and strategies every day in the context where their child lives, it's not going to be effective.
All I have. I want to say that I appreciate your time. I know that you are a very busy woman, although I don't. if you're like me right now, it's a little bit different because you don't know how busy you are because it's you're working at home, but it's kind of strange. Uh,
It is.
but I appreciate your time. I appreciate that you trust me enough to send people my way, and
Absolutely. We're glad you're there.
yeah,
We appreciate that you're supporting families in that area because it's such a huge need, and you're kind of like an oasis in the desert, so to speak. You know,
I feel that way sometimes. Yeah.
I
Um,
bet, but
but
you are.
well, and just know that you're appreciated, and know anytime I need something, I either email you or send you a message or call you, and you never hesitate to help, and I appreciate that. So thank you.
Well, we're glad to do it.